Jaundice by Karen, Tracy, and Danica. While completing a discharge check on a 3-day-old baby, a nurse notices symptoms of jaundice and notifies a doctor, who refers the baby for a blood test to gain insight on bilirubin levels. Jaundice is an abnormal yellow skin tone. Yellow bile pigments accumulate in the blood and are deposited in body tissues. These pigments have a high affinity for elastic tissue, such as the sclera of the eye, because it has high proportion of elastic fiber.
Macrophages separate hemoglobin molecules into protein, globin, and heme. The heme is further broken down into iron for recycling, carbon monoxide, and biliverdin. Biliverdin is processed to form bilirubin. Unconjugated bilirubin is insoluble in water. It attaches to albumin for transport through the blood to the liver for excretion. In the liver, bilirubin is joined or conjugated to another molecule, glucuronic acid, to make it more water-soluble. It allows it to be excreted into bile. Bilirubin gives bile its color and is formed by aged red blood cells. Bilirubin is excreted from the body through the large intestine in feces or through the kidneys in urine.
Abnormally high bilirubin in the blood results in a yellow discoloration to the skin. It becomes evident when serum bilirubin levels rise above 34 to 50 micromoles per liter. The normal amount is 2 to 20 micromoles per liter. Excessive circulating bilirubin forms as a result of the breakdown of hemoglobin. Bilirubin can cross the blood-brain barrier and attach to developing brain tissue. The most vulnerable areas are those which control hearing and motor function. Damage is relative to the severity and length of exposure. The most toxic form is the unconjugated bilirubin. Jaundice is more common in newborns because an infant's liver is not fully mature enough to remove the bilirubin from the bloodstream. When the baby is in the womb, the bilirubin is removed through the placenta. Infants have more red blood cells in their bloodstream than adults, and the red blood cell lifespan is about half that of an adult, which is 120 days.
3 major causes of jaundice are excessive destruction of red blood cells, impaired uptake of bilirubin by liver cells, and decreased conjugation of bilirubin.
Infant risk factors include premature birth, blood type. If the mother's blood type is different from her baby's, the baby may have received antibodies through the placenta that cause his or her blood cells to break down more quickly. Breastfeeding. If the baby is not feeding properly, this can lead to dehydration, poor nutrition, and constipation, which increases bilirubin reabsorption. Or if enzymes in breast milk deconjugate the bilirubin, this causes reabsorption as well. About 60% of term babies and 80% of preterm babies will develop jaundice within their first week of life.
The most common symptoms include yellowing of the gums, skin, and the whites of the eyes, dark urine, and pale stool.
Infant treatment includes phototherapy, which is when bilirubin breaks down in the presence of light. It converts unconjugated bilirubin into a conjugated and excretable form. Also, lifestyle and home remedies include more frequent feedings. This will provide the infant with more fluid, which causes more bowel movements. More frequent bowel movements will increase the levels of bilirubin being eliminated. After the baby's treatment of phototherapy and frequent feedings, the level of bilirubin in the baby's blood sample decreased to a normal level, and he was released from the hospital.
Although we focused on jaundice in newborns, jaundice can affect adults as well. Jaundice in adults can be caused by alcohol abuse, liver and pancreatic cancer, hepatitis, or adverse reactions or overdoses to medication. Jaundice in adults usually clears up when the underlying cause is treated.
Summary of the key concepts. For the cell membrane, unconjugated bilirubin can cross cell membranes easily because it is insoluble in water. This means that bilirubin can cross the blood-brain barrier. The proteins involved include the enzymes that catalyze the reactions that were mentioned earlier, the enzyme oxygenase, which produces biliverdin, the systolic enzyme biliverdin reductase, which produces the bilirubin, and the protein albumin, which carries unconjugated bilirubin through the bloodstream. Homeostasis. The liver is unable to remove excess bilirubin because it cannot be converted to an excretable form.